Hello, I am Dr. Vinita Bendare, Director of Rasayu's Yumna Women's Clinic. In our last episode, we have seen what impact PCOS can cause in fertility or in conceiving. In this episode, we are going to see how Ayurveda can help to address these challenges. So just to reiterate quickly, we had seen that PCOS can cause anovulation, that is unavailability of the female egg for conception. It can cause hampering the quality of endometrium, which is the internal lining of the uterus. It can cause obesity and it can affect the mental health. And Ayurveda considers mental health an important factor in both partners for conception to occur. So, going back to ovulation, how Ayurveda can help in ovulation. So, the thought process of Ayurveda in treatment is always to aim at correction of certain changes that have occurred in the body. So in this case, we see that the ovulation process has been hampered. So Ayurveda aims at correcting the ovulation process, or precisely helping the body to go to normalcy so that the ovulation process occurs naturally. And for this to occur, only this process is not thought upon, or only this process is not considered. The complete metabolism of the female is considered, and along with that, this process is also thought upon or considered in the treatment. And while forming the treatment plan, it is important to understand the complete case history of the woman along with the investigations. And these investigations here particularly include mainly the ovulation study. And this ovulation study, it is important to understand whether the follicles are maturing at some level or there is no growth of the follicles at all. In normal conditions, it is expected that the growth of the follicle should be around about 18 to 20 mm before they rupture. On which day they rupture, that is also considered. And also the endometrial thickness, or the inner lining, the growth of the inner lining, how much is it growing? Around 8 to 10 mm is considered to be a normal growth of the endometrium for conception to occur. So these patterns of the ovulation need to be studied in the particular patient, and accordingly then the treatment plan has to be planned. In treatment plan, there are internal medicines, along with that specialized Ayurvedic treatments are included, and also lifestyle changes are provided, or specific personalized lifestyle changes are advised. These lifestyle changes are important because, as we have seen, we are considering changes to occur in the complete metabolism also. So this together, when a treatment plan is formed, generally after about a couple of months, it is expected to see changes or correction in the ovulation pattern. Sometimes it also happens that during the ovulation study also some medicines can be given, some specialized treatments can be given, so that the rate in the increase in follicle size is also seen within a couple of days, or to help rupture the follicles, sometimes different treatments can be planned. So overall, Ayurveda can help improve the process of ovulation to a good level. The second part that we thought about was the endometrial health, or health of the endometrium. So the line of treatment or thought process is similar to what we have seen in improving the ovulation study or the process of ovulation. In some cases, it so happens that particularly focus needs to be given in improving only the endometrial health. So in this case also, the treatment plan or pattern is the same. The internal medicines or the medicines that are used in the particular specific treatments can vary. Obesity, again, though it is a challenging thing, it can be addressed well. It needs dedication and it needs consistency. Some of the particular therapies of Ayurveda are also helpful. They can be administered or they can be planned for particular patients, and lifestyle changes on personalized level. Those are also important to address obesity. And mental health. As I said, mental health is a very important aspect to be considered here. In the first place, it is very important for the patient or to counsel the woman to understand that going through PCOS or facing some challenges regarding conception is not her fault. She should not feel guilty regarding to it in any way, because many a times patients are seen to form such kind of feeling regarding themselves. So that in the first place needs to be addressed properly. Secondly, Ayurveda has very good therapies like Shirodhara to address this particular mental health, and it has seen to have good results in treating mental symptoms like stress, anxiety, insomnia, brain fog, and so on. Also, it is seen that when the progress is assessed periodically and good progress is seen, that also helps the patient to improve their mental health, and helping the physical symptoms or relief in physical symptoms can also help them to improve their mental health. One important point I always feel is some me time is very important, because in the routine everyone is so stressed about hustling here and there, and that important factor is missed. The one thing that a person likes or loves to do. It can be reading, it can be writing, it can be singing, it can be just sit and relax. This kind of me time for about say 5, 10, 15 minutes also per day can be a booster for rejuvenation. So today we have addressed how Ayurveda can help with regards to certain challenges which are observed because of PCOS for conception. In our next episode, we are going to know more about lifestyle changes that can be helpful to manage PCOS. Till then, bye-bye and take care.